Hi, I'm Dr. Tom Kadar.
And I'm Dr. Mark Morrell. Welcome to our practice.
We can't wait to create a smile that you'll be proud of. Thank you for beginning treatment with us and trusting us to give you the best smile possible. The journey to a great smile is very rewarding, and I'm going to give you some ways to make it successful and allow you to finish on time. Clean, healthy teeth make the best smile. Continue to see your family dentist for regular exams and cleanings. Do your best to keep your scheduled orthodontic appointments. Missed or last-minute changes will typically lengthen treatment time. Follow the directions given by us to your best ability. Great cooperation leads to great smiles. Never leave the office if you have a question or concern. We are now part of the same team, and we want to help you every step of the way. We have one pretty amazing location, so you'll always know where we'll be. And we'll work together for any treatment decisions. Be sure to download the My Orthodontic app on your smartphone so we can send you cool information that you can reference as needed. You can schedule appointments and send us messages directly through the app. You know, our mission is, we want to improve the world we live in, one smile at a time. Well, let's get started. Your treatment will include a combination of aligners and appliances. There are some simple things you can do to keep treatment on track and prevent problems. It involves how you eat and brush with your new appliances. We often begin a combo treatment with a motion appliance.
Hi, I'm Juliana Kadar, Dr. Kadar's daughter. My dad asked me to talk to you about what treatment you may need before braces or aligners. They're called motion appliances. These motion appliances were created to help fit your teeth in a better position before you get your braces or start wearing aligners. They fix the toughest part of getting teeth in line first, so that when it's time for your braces or aligners, you can get finished faster. Actually, a minimum of 6 months faster. And isn't that what everyone wants?
When your bite correction starts with a motion appliance, there are a few components that you'll hear being talked about, so let's look at them now. First is the motion appliance. That's this Carrier Motion 3D part. It just attaches to your teeth. Like everything here, it's a painless procedure. We just place them on your teeth with a unique adhesive, then you're ready to go. After a few days, they're comfortable, and most patients don't even notice them. The motion appliance consists of two simple parts, the power arm and the button or sidekick. A button is placed on your teeth. Again, it's tiny, painless, and what it does is allow you to attach the elastic to the correct tooth. You also hear about elastics. They're special rubber bands that make the motion appliance work. They kind of act like the gas pedal on your car. While you wear them, you're going full speed. If you don't wear them, the teeth will not move and your treatment is at a standstill. When they're in, they look like this. There are different sizes that we choose for you, and what they do is to help move your teeth and their bite in the right direction. It's important that you follow the direction and wear them as we ask. When you're home, you have to change them at least 3 or 4 times a day to get the best results. It's easy to remember because you have to take them out when you eat and brush your teeth. Here's a simple demonstration of how to place the elastic for the motion appliance. Always start in the back. The molar hook should be placed first. Once that's on, then you can bring it forward to the power arm, let go. If it stays on, you've got it. The final word you might hear is retainer. With all motion appliances, all patients wear a retainer to prevent unwanted changes. A retainer is a custom-made piece that fits in your mouth. It looks like this. And goes in like this. It's extremely important that it's worn all the time when you're wearing your elastics. It's extremely important that it's worn all the time when you're wearing your elastics. That's because the motion appliance, elastics, and retainer all work together to get the job done.
On the day your motion appliance is in place, you will only experience minor discomfort. I mean, you have new stuff in your mouth, right? It's okay for your parents to give you an NSAID medication like aspirin, Advil, or Motrin. They will help relieve any soreness you may have. As the motion appliance does its thing, you may notice spacing of your teeth or little gaps, which is normal, and they will be addressed later when you get braces or aligners. You will begin the motion elastics a few days after the appliance is placed. You can expect to feel soreness, but continue to wear the elastics and retainer and it will go away in a day or two. The retainer will be worn whenever the elastics are in. The retainer needs some basic care as outlined here.
Don't forget, it's really important to keep the aligners and retainers clean. I like liquid or soft soap, and I'll use my regular toothbrush and run it on the inside and outside of the aligners to make sure they stay sparkling clean and they smell great.
See, the Motion appliance is easy to wear and maintain. If you follow the tips we outlined, you should be finished the Motion part of treatment in 3 to 6 months. Hi, I'm Juliana Kadar, and I want to share some info about virtual appointments with you. Actually, check this out. It's my orthodontist. Okay, it's my dad, but he's my orthodontist and he's yours too. And you can do your ortho visits virtually. It's super easy, saves you and your parents a ton of time, and if you're not experiencing any problems with your treatment, they are the perfect way to go. We have it all set up on our website. Just go to gokadar.com. Now that you're a patient, click on the blue button and sign in. That's it. We also added this yellow bar, and it explains exactly how to take the pictures that you need for great pictures for your virtual visit. I would say click that first so you do it right the first time. The photos are easiest to take with a cheek retractor, and if you need one, we can provide it for you. Of course, you will need a traditional in-office visit, but for some of them, give virtual visits a try. They're easy. It's the absolutely safest way to have a visit and saves you time. All good stuff.
See you soon on your phone or in person.
Good stuff. Well, that was an overview about the office, and now for some info about your specific treatment.
Once the Motion appliance does its job, all you need to do is wear your aligners. There are some simple things you can do to keep your treatment on track and prevent problems. It involves how you wear and take care of your new aligners.
Congrats! The cool thing about aligners is that you remove them to eat and brush, which means your daily routine doesn't have to change. I have a few helpful hints to make your treatment successful. Wear it, keep it clean, don't lose it. You should wear your aligners 24/7. Only take them out to eat and brush. Don't drink anything sugary while wearing aligners, as this may cause tooth decay or staining of your teeth.
Hi, I'm going to give you a little quick review of how to place your retainers or aligners. You grab them, use finger pressure, place them over the teeth, seat them completely on with your fingers, don't bite them down. Obviously you want to clean your fingers first, and once they're on, you can squeeze them with your teeth if you like to. That's it. Occasionally your aligners need a little help seating. We use these little things called bite sticks or chewies. I'll show you how it works. You squeeze on the spot that needs a little help, bite on it for about 10 seconds, do that several times a day, and that's it, real easy. All right, now this is how you remove your aligners or retainers. First off, make sure your hands are really clean. Then you can use your fingertips, grab the edge, pull down, comes right out. Couple seconds, it's out of there, and you're on your way.
If the aligner has been worn properly, you will be instructed when to advance to the next aligner in the series, which is usually every 1 to 3 weeks throughout treatment. Please keep aligners in their original bag when you advance, as they may be needed in the future. Don't worry, you may feel some soreness after each new aligner is placed. This passes in a day or two. Over-the-counter pain reliever, such as Tylenol or Motrin, can be used as directed if needed. Now, let's talk about aligner care. It's really easy. Every time you brush your teeth, you should clean your aligners with either toothpaste or liquid soap. Denture cleaners can be used if your aligners need an extra cleaning boost.
Don't forget to clean your case too.
So you know how to wear them and clean them, but the really important part is to not lose them. When you remove your aligners, always place them in the case provided. Do not wrap in a napkin or paper towel or leave unattended for our furry friends to chew on. Hi, Juliana Kadar here. We're seeing a lot of each other at this point, aren't we? Well, just being honest here, this is my absolute favorite topic, food. When you first get your appliance or braces for the first 3 days, you'll want to eat only foods with a mashed potato consistency. So food that doesn't require a lot of chewing, like soups, mashed potatoes, smoothies, milkshakes, and Jell-O. During the whole time you're wearing any appliance or braces, cut up apples, cut corn off the cob, and cut meat off the bone. A good rule is if you cannot break or cut it into smaller pieces, you shouldn't eat it. There are some types of foods you need to avoid the whole time that you have your braces on. Basically any food that's hard, like pizza crust, nuts, hard candy, or ice cubes. And everything sticky or chewy, like gum, taffy, or candy. Braces and appliances are meant to come off someday, so these foods could break them. It's easy to remember. If it's hard, sticky, or sweet, it's bad for your teeth. That's super important, so let my dad tell you.
Remember, if it's hard, sticky, or sweet, it's bad for your teeth. Hey, how you doing today? You may not know that soda and fruit juices are considered sweets because they have high sugar content. Stick with water as a drink to sip all day, every day.
Other things can damage your teeth and braces too. Avoid biting or chewing on foreign objects like fingernails, pens, pencils, or mouth guards. You also need to avoid pushing on or playing with your braces and wires. This can damage or distort them, which may extend your treatment time, and nobody wants that. That's it for food. Remember, if it's hard, sticky, or sweet, it's bad for your teeth.
And cut!
Ugh, all this talk about food's making me hungry. I need a snack. And now, bum bum bum, retainers.
Retainers are used during motion treatment and when you're done with active treatment. When you're done with active treatment, we want to keep that smile lasting. This is why all our patients get a final retainer. Wear it well for a lifelong smile. The schedule of when to wear them is different for everyone, so someone from Team KDAR will let you know those details. Starting orthodontic treatment is an exciting time. Remember, we're with you all the way to make sure the process is fast, easy, and fun. And to help keep your treatment on track and prevent problems, remember the 4 important KDAR family rules. Number 1, keep your teeth clean. Number 2, stay comfortable. Use Tylenol or Motrin if needed. Number 3, feed the belly. Don't stop eating. Number 4, stay busy. Keep active. It keeps the mind from thinking about the appliance.
Well, there you have it. You've begun orthodontic treatment. I bet you feel like an expert by now. If you have any questions or concerns, just ask. I bet my dad or anyone on Team KDAR will know the answer. Or visit gokdar.com for more information. See you soon!